We're good.
Look at that.
Yeah. Thank you. Where is it? Looking at your 25.
Okay, we are ready. We are still missing one board member, but we're going to hope that he shows up here shortly, but we have a quorum, so we can move forward. So I will call the meeting to order. Would anyone like to motion to adopt today's agenda?
Yep, I'll make a motion to adopt the agenda.
I'll second. All in favor of the agenda? And I can motion to adopt the minutes for the last meeting. There's none. Okay, never mind. We'll do that next time. Okay. That, okay, well, that was easy. Next we'll move into personal appearances. If you don't have one, there is, I believe, an agenda on that table over there. First, for our appearances, we have Teresa Bilgo. Sorry, no? Okay. Joseph Miller. Oh, wow. For two. We haven't heard from either of those. Okay. Let's move on with that. Yeah, this is gonna be our fastest meeting. Okay. Then we have Sora. Sora Stein. Hey. We have seen each other before, so I don't have to go through the same spiel of.
Yeah, thank you for letting us back on the agenda.
Of course.
Obviously, we're here with supplemental records from Ms. Stein's pending application. We included this time, the evaluation you requested, several letters of support from people that she collaborates with locally, and then also, a letter from our proposed monitor. I know you guys wanted to see that, as well as that person's resume. So you can see her credentials and work history and all that. So. I think that was-
Quite a few letters. Who are you referring to?
Yeah, so last time we had supplied Kaminsky,
Okay.
Newman, Barthold, Lehman, and Gavoni. And this time we added, Corey Barron, Tommy Guest, Megan Gildersleeve. And Megan Gildersleeve also wrote a second letter about her offer to serve as, a monitor or mentor for, Ms. Stein per the board's request. That's why we also included her resume.
Okay.
William O'Connell, Connor, the one as well. Andy.
Okay.
There's a lot of stuff in this one.
Yeah.
And each of these people writing letters, on Ms. Stein's behalf, they're aware of the incident in her history. So they're speaking to this with a full understanding of her, presentation for a license.
Well, thank you for completing the items that we had asked.
Mhm.
Does anyone have questions regarding the psych eval or the additional documents?
I guess I do under the mentorship and, we have a discussion on the board of what we're looking for in that. As I guess I personally don't have any concerns about your clinical ability. So the review and discussion of case summaries, I don't know if that's necessarily, you want that.
But she was, I think, just trying to show she can offer the full range of whatever the board might need.
Gotcha.
Yeah.
Okay.
Yeah.
Please submit. Okay.
Mhm.
I'm looking at that just.
Yeah, right now. Go ahead.
No, I was just, okay, I guess there's a lot of pieces to this, right? So if we go forward with licensure, is this something that we would require, that she has this, and is there a period of time on this, or like, what's the scope of it?
And this mentorship is mentoring the people that you employ, correct? Or mentoring you?
She's offering to play a sort of a monitor, supervisor, mentor type role for Ms. Stein specifically.
Okay, Megan is.
Yeah.
It was listed in one of your requests.
I think the April letter, yeah. you guys-
Yeah, we were seeking out someone to kind of be, as a business owner and all people reporting under you, we had concerns about whether there would be anybody able to, inform Ms. Stein that her behavior was maybe inappropriate or her mental health was off. Hi, Erin, come on in.
Sure, and also be able to report to the board.
Yeah.
Concerns,
Yeah.
and she's more than willing to
So-
do that, yeah,
Okay,
absolutely.
if we want to pause and let Aaron get himself
Yeah.
situated,
Appreciate it.
Sure.
no need to apologize,
Sorry.
take your time.
We're on Sora Stein.
Okay.
It's humid.
Very.
Yeah.
This is in Detroit.
Yeah.
This is for month. Mhm. Yeah.
Yeah, there's a huge area.
We were discussing the mentor letter, from Megan Gleider's regarding some mentorship that she would provide Sora if she were to receive a license. So Jill, you asked the question of whether, or what our responsibility or Sora's responsibility would be to this stuff with a license, and if we could hold her to anything there. I don't, you know,
So you have the ability to grant a license on probation that you were concerned about ability to practice with reasonable skill and safety.
so it would be under appropriate, some sort of, yeah, something like that.
That would be the way in which you could have those conditions.
But typically that's intended to be temporary, am I right? There
Correct.
need to be a means to an end.
Right.
It could, my office, we do a lot of licensing work in the healthcare space. We have a lot of doctors and nurses who are on probation. When they have a practice monitor, typically that monitor has to submit a quarterly report to the board attesting to certain information, observations for that prior quarter. They also have a duty when they agree to be a practice monitor to report certain more concerning events or situations to the board within like 7 days or something like that. That might be what you guys are looking for here.
Yeah, yeah, we would come up with something like that, yeah.
So,
And I did have a specific thing on the monitor, I noticed that when they did monitor some other licensees, you want to put in their specific things you want to know.
mhm.
In that one.
Yeah.
Because they want to, just a report from the monitor.
Yeah. Here I am.
Yeah. Well.
Um, I think I struggle with what that would look like and how that would, and, you know, what would constitute, okay, she met the parameters, so we can let it go, move it to a full license.
Yeah, that, and then the timeframe that's already passed since the incident,
Sure.
that's like, you already passed.
It's not like we're looking for, yeah,
Right.
yeah, there's not, yeah, something's still pending or happening.
Is it fair to ask them then like how they envision it working?
A license, a probationary license?
Well, correct, and also, you know, maybe the specifics within the practice monitor, and they can give you an idea of maybe what they're thinking, and is that fair?
It's totally fair. Absolutely. So, I mean, as you pointed out, this is an older incident. I'm not negating why the board is paying attention to it, but, it is an older incident that by every measure, according to her colleagues and her evaluator, it's pretty much resolved. It doesn't mean the board's oversight is, you know, not necessary. It's your judgment call on that, but this isn't something that is recent or ongoing. And so we would propose, really just the traditional monitoring that we've seen with many other boards here, with the quarterly reports, where the person has to attest to the board professionalism, quality of the actual work, any, information about arrests, incidents, of unprofessionalism, any broader concerns about her ability to safely practice, all of that goes in the quarterly report. You can require her and her monitor, of course, to meet at a certain regular interval over the course of each quarter to make sure that that information has a way of coming forward. You know, I know just from understanding this situation, this particular monitor, of course, also has the ability to access all of Ms. Stein's employees. So if they need to channel any concerning information to the monitor, that would also have a way of making it into the reports to this board. We would propose a 6-month probation, given that this is an older incident. That's typically the smallest that I've ever seen with these other boards. They can go on indefinitely. But typically what I've seen is that you do a certain minimum period at which point she can then petition to have that probation terminated. It'll be up to the board to then decide whether she has demonstrated she's fit to practice without any further monitoring or oversight.
Who's the monitor?
So,
Okay.
Megan Gildersleeve was our proposal, yeah. We included her resume and 2 letters from her.
Yes.
Right, she works at your.
She might fill it in if I need to be out.
Okay.
She works elsewhere full time.
Okay.
But she knows if I need to take a week off or
Is she considered your employee?
she does technically get a W-2 from me at the end of the year for any time that she's provided coverage.
The substantial portion of her income comes
She works,
independently of this time.
yeah, she works for another clinic full time. She might do 2 hours here, 3 hours there if I'm out. I've got bronchitis, I need to be out of the office this week, can you cover?
Yeah, I'll be honest, it's been very hard to find a monitor, given that this is a newer license. There aren't a lot of people available, and the people who are available with this, they're not necessarily interested, so this was the most independent.
There is also BCAA at the time in my office, obviously, full time in my office, but there is somebody physically there who would fall under the same jurisdiction. He's still waiting for his license to be approved, but he would still fall under the same jurisdiction.
He's there.
side question. I noticed Andy O'Connor has the same last name as the psychologist who did your assessment.
No relation whatsoever. It's a common last name.
Totally fair question.
Did Megan was she once employed by your?
She was once, at one point, she was unemployed and we were helping her pay her bills by giving her some more hours than we are currently. We kind of like helped her float a little bit until she found, a full-time job. She was doing largely Medicaid waiver consultation though, and not in the clinic.
I think for me, if we were to say she's an OA monitor, I wouldn't want her working.
Yeah.
At all, picking up any, at all.
Yeah.
Preferred.
Right, well, we can adapt
I'm
that.
talking,
We can, we.
you know, like, no, we're not getting extra hours.
Right.
No PRA,
0.0 hours, yeah.
this is sole purpose,
Mhm.
is this.
We're happy to agree to that. for sure.
She does still have one Medicaid waiver client. Would that be separate? Like, I don't have to terminate services on a client.
I mean,
it doesn't involve
that's
everyone.
part of the business that you own and operate though.
I mean, I have nothing to do with that client whatsoever. It's
Well, but you own and operate those services.
Yeah, I mean, it's a client who is really just.
So then, yeah, I would say that counts. Like if you're looking for her to truly separate it, her still seeing one patient, whether it's waiver services or ABA, to me would still be. You're paying for some compensation.
Yeah. And that's important too, in the event that something were to, say she no longer saw those patients.
Mhm.
We just want to make sure that there's no, she's supervising, there's no conflict of interest with that, if she's separated from the patients, and then
Yeah.
she can't supervise appropriately, so.
We can figure that out, yeah. No problem.
What is South Bend autism? South Bend autism.
I don't know why that ended up in somebody's letter. It actually was our website address. And so somebody thought that was the name of the company.
On Megan's resume, she lists you as a reference in your relationship as supervisor.
I was at one point years ago, yes.
While she was working with you at the Fluency Connection.
Well, she was my employee, so.
Okay.
Because she was my employee,
Uh-huh.
seeing kids in the clinic,
Yeah.
therefore I was technically her employer / supervisor.
And how come she doesn't have that on her resume under employment? That just
It
seems a little.
it was just very short term. That's
Sure,
all.
but
Yeah, it was, and like I said,
Let's make sure.
it's been coverage at most for the last several months. I'm in the original editor, 2020. That was like October, almost 6 years. And we get all the ACP requirements. 2022, and then close the case. Memory is correct. Was it 24? I think it was sometime in 24, February, it was early 24, I believe, that they fully closed the case when the legal case was dismissed. So the board only kept it open pending the legal case being
It was
dismissed.
January 2024, and then it was expunged May 2024.
Adam, can I ask you a question?
Sure.
Say that Lexinger had been active at that time and her license was revoked or suspended or something as they investigated it. How does one
get it back, or do they?
If it's revoked or suspended, they would petition back to you for reinstatement.
Once you lose it, it's not like lost forever, you could petition for it.
Right.
Potentially, just curious. Because I'll be honest, I do think of that, if licensure, while we were aboard, just then, we did not have rules established, and we weren't in this process quite yet, but it has been on my mind, had this event happened while licensure took place, it would have been no questions asked, your license would have been taken.
Mhm.
So I think timing,
As would it for other professions.
uh-huh. Mhm.
Question is would it have been a lifetime suspension?
Yeah.
And what would that look like?
And what would we need?
Typical for findings for abuse from other licensing boards. That would be a lifetime suspension.
Mhm.
But something like that maybe do.
I can see from my part, I represent a lot of people who've been in those situations, and that's not just the case. A lot of them have gotten their licenses back, especially when the criminal case has been expunged.
I think another concern is that you yourself did not report it to the BACB. It was a provider not even within your organization.
I was in jail. I couldn't. Somebody got to it first, is basically what happened. And that was noted when I communicated for it.
Would point out the BACB has also cleared her. They had their oversight much closer to the incident. They set out a step or a series of hoops for her to jump through. She satisfied everything that they were looking for. So it wasn't this board, but there was a professional board in this field and monitoring her much closer to the incident. They have signed off on her returning to guidance without that. She also has two other state licenses, which are granted to her with a full understanding of these events. They're granted without any restrictions, monitoring, discipline, so on and so on.
And I appreciate all that information and it does contribute.
Mhm.
I think we would be remiss to not consider the state of ABA therapy in our state in
Of
particular.
course, you have your own oversight.
The federal government, local government, Medicaid, they are very heavily looking at our field. And I think, RBTs as rendering providers and background checks is all new to us as a field. And I think our responsibility as the licensure board is to ensure that children with autism who are often nonverbal are never at risk. And that we are ensuring that the services provided are ethical and safe and all the things that they need to be. So it's a heavy decision and.
Of course.
And I know you understand that. And I also understand it was 6 years ago and a lot has taken place since then.
And it was explained as a medical event, right? This isn't a character issue. She's had multiple medical providers and her evaluators assess that this was caused by a specific medical intervention that went very poorly for her. This isn't a reflection of a longer, broader risk associated with her behavior or her character. That medical risk was then removed by a change in her medical treatment. So we identified the cause. This isn't like she just had a random outburst because she was stressed out. This was a medical situation. And now the doctors are saying, we're good. That's over.
Questions or motions?
I would support possibly a probationary period longer than 6 months. At least a year, if you have it as strict as we. But, my thoughts to ensure that we're complying to everything. This is because it is very serious, as you all know, that pointed out. that said, she has put forth efforts to try to get the help she needs as well.
I appreciate the efforts there for sure. I struggle with the incident itself. And in my practice, that I struggle with that. Gotta be honest, that's a hard one to get past. Not to say that you're a bad person or nothing like that. It's just the event. And I do believe people deserve second chances.
Sure. That's why I'm emphasizing this, it's caused by specific medical intervention. So you take away that intervention, you take away that event.
But I think one thing you need to consider is if you go down this road and you grant some sort of probation and have some monitoring or supports, continues along the path, are you going to be any more comfortable with the practice after that is completed? Because they're putting forth an argument that this was a very limited, isolated situation, so you need to be able to effectively identify what exactly is the deficiency that you're seeking to remedy by doing this probation.
And there's precedent. We're gonna repeat. You know. The next situation.
Right, and well, I appreciate this offer, that's great. She's got so much less experience than me. Yeah. So, I think maybe your original mentor under the BACE guidelines.
They're not really now.
No, I know.
Right, no, I got plenty of people out of state who have years more experience than I do, but they're not in state. And so finding somebody local, I mean, I've been doing this for 32 years. So finding somebody local who has that level of experience is really hard.
So I'm sure one of I think you already maybe received what we're thinking. So,
And the supervisor for the BACB was CJ Kennard, who's in his 70s and has been doing this for like 40 or 50 years. And that was part of why CJ was chosen as somebody senior to me.
I mean, yeah, I think that's what I'm kind of pointing out to you is I think you may feel more comfortable with saying, let's do the probation of some of these conditions, but everything that I've heard you talk about is, for the most part, aside from specifically having a practice mentor, stuff that she's already done.
the original.
Yes. Those stuff.
That's the one. Hearing law. It's in the comprehensive document. You're saying Ms. Melton recorded it while you were incarcerated.
Yeah. I didn't get a phone call, so I certainly wasn't getting a computer to be notified for it.
How many days were you in jail?
Again, so it's I'm there Friday, days for different time. And it happened like the day of, like, I'm not mistaken.
requirements.
There's another organization in the area.
Yeah.
What kind of date that it happened?
They,
She reported it. Oh, I don't,
No, the date that the incident.
it says the 23rd.
21st, 23rd, something around there.
Third on one, but I think
23rd
23rd.
October 23rd, yeah.
is when Miss Melton reported it.
That's the
Date
day
of
of the-
alleged
Oh.
violation.
It was in the April folder, Stein comprehensive.
Yeah.
That's a lot in there. So it's not-
And then it says Brittany's notified 6 days later, the 29th.
Let's see that.
At the bottom of that document. The fair signature, Brittany, Melton, date.
Yeah, 10/29.
That's what I said. And any idea why anyone in your organization wouldn't have reported it?
To the best of my knowledge.
Really?
What was the answer? I said, to the best of my knowledge, none of them thought it was reportable. Like, I remember some of them telling me they were surprised it got reported.
Obviously, they would have an opportunity to learn from this incident as well, 6 years ago, to the extent that it's even the same staff.
Right.
Also, like, there were, I don't know exactly how many people were in the building at the time, but I know that there were at least 3, and 2 of them were no longer my staff, but, they didn't express really any concern with the incident overall.
Many people still were that were there for all this event.
One was in the building at the time, at least that's what she tells me. And one was not, in the building. That I'm not sure.
Just 2.
Who witnessed it?
So one of my RBTs, Mandesha, said she was in the building at the time.
What's her position when you know?
She's still married.
Was the mom there? And so who saw it that then told Brittany?
The mom gave Brittany secondhand information.
Okay, so somebody told the mom what happened.
Yes.
I don't know if you reports from your, that supervisory time period.
From CJ, there were 4 VOCs, and I think that my VOC might be the way to find it.
Okay, thanks.
Yeah. The Board of Public Verifications of Competence.
So is the child immediately not a patient of yours anymore? They pull certain services or they continue service?
I honestly don't know if they came back for another day. I wasn't there.
Did they ever, like, say maybe not within those first few days, but then they stop services with you eventually?
They did, yes. The kid actually ended up in out-of-state residential.
So when somebody is supervising, this is something that I don't know. When somebody is supervising or like in this situation, how much direct care does that person have? Because you can have people providing care and you're supervising it. Or is it very hands-on directing?
Like a traditional BCBA with a caseload, how much are they providing
Mhm.
time with it? Usually 10 to 20% of their time. So say they're in therapy for 20 hours a week, they'd be getting 2 hours a week with that BCBA. That makes sense. Is that what it's really?
Yeah,
Are
that
you
helps
asking
me.
about supervision time versus direct therapy time, like how much
Like
time
who's-
needs to be working with a kid?
With the child. Yeah,
One-on-one?
who is one-on-one with the child most of the time.
An RBT.
RBTs. The PCBs might fill in if you're short staffed for it, because RBTs are out sick or something like that. Not common for a PCB to be doing 30 or 40 hours a week of therapy direct with kid. Happens, but not frequently.
And in your practice, how many, like, I just don't understand the picture. You have really young journalists. So a parent brings their child in. They drop them off. How long are they under your care?
Depends on the kid and their medical necessity for hours of therapy. So we have some kids who are in for an hour and a half after school, a couple days a week, working on, just fine tuning some skills. And then we have some kids, the most we have anybody right now is 4 hours a day, and they go to school part-time.
How many kids do you have in your practice?
At the moment, 5. Yeah, that's small. We've been intentionally small because we can provide more attention that way, and I'm sure that we're meeting the supervision requirements and paperwork requirements and everything else without staff getting overwhelmed and burnt out.
So Megan's not employed with you right now. Who's providing those for children BCBA times I do?
No, because I don't have a license for practice.
Who is?
Who is that?
She's been doing some of it while I'm out.
Megan has?
Yeah, and then we have another BCBA who's been doing some of it as well.
And who is that person?
Her name's Maureen.
Sorry?
Maureen.
What's her last name?
Sorry, I had like, Maureen Fox.
And
So
she's licensed by the.
she is licensed by this board. Her license came through last week, so she was providing until July 1st, some of that time. And what we've done is curtailed some of the therapy hours right now to align with what limited availability Megan can provide for supervision based on her full-time job. It's, like I said, I have a BC ABA, because what's the still pending, so we can't do supervision.
That wasn't the,
Yeah, that was, I'm just.
Yeah.
The full lineup.
this wasn't my question, but now I have, I think we're back to Megan is an employee of yours, and I feel like you're kind of trying to skirt tail around that, but she's providing services.
Except that she would no longer be providing services. She would stop providing services. And then also presumably at the point that Corey's license gets processed, we have a BC ABA with an assistant supervision as well, if I need to be out.
It's kind of a unique limbo right now. For license requirement obviously just took effect.
Gotcha. I think all of that being said, though, Dr. Anderson, you had mentioned that a probationary license could be a consideration. I don't know that I feel comfortable with that. I don't know what we would be looking for that would make me feel better or worse, I think, and who that mentor would be. I'm not feeling comfortable about, so, my personal opinion, I'm not that middle ground right now.
I would point out, the board did set out a number of things that they wanted to see from Ms. Stein in order to properly assess where she was in
Yeah.
her risk, where she was in her professionalism, her conduct, and so on and so on. Every single colleague who's familiar with Ms. Stein has said unequivocally, she was very good at this job. She could be trusted to do this job. She got a professional evaluation. They said there's no risk. No risk. And again, this was a medical event that took place 6 years ago. And with that medical intervention gone, the risk of this happening again is gone. So, to the extent that the board wanted to see all these things, we really need to be clear that everyone who's speaking to the board about this is saying she's rock solid and can be trusted to do this job. And frankly, she's darn good at it. The new license is not a new career for her.
I think our concerns the first time we met with Ms. Stein was, many of the letters were provided by people that she employs, so there could be some bias there, but and then several letters provided by people who she's only had virtual relationships with, which again, not bias, but demonstrates that they don't see the day-to-day practice and her supervisory abilities and all of that. I think virtual is wonderful for many things, but for some things it is a challenge.
And that's why we provided a number of letters from people who are more local this time. You'll see that every single person is from the area.
But again,
It's
many
all
of
the
them
same
are
feedback.
employees.
So all of the letters, there's nobody who wrote the letter who doesn't know me in person.
Right.
It's just a matter of the majority of the interactions
Right.
are remote because we live in different states. And that's the nature of the world these days, but, like Dr. Barthold, we interact with, Zoom on a regular basis. She interacts with my BC ABA on a regular basis, also telehealth kind of. So it's not like I don't know any of these people in person. And they're just, Facebook friends and everything.
Right.
I would also say it's different, just for your consideration of Wayne's letters and the application info presented to you. I think it's different if you have someone who is in another state that you have no jurisdiction over, that is an employee, you're concerned they might be giving bias input, right? But I think part of the logic that you have saying you want folks that are local wasn't just because whether or not they're employees, you can certainly consider that as part of it. But even if they're employees, if they're licensees under you, they're stating their reputation. And they're standing before you based on what they're presenting as testimony. And also, if I may, like just looking at the whole process too, I think in the beginning, I think there was a feeling that there was maybe a different attitude to this application process where we kind of had the partial information before us that we had, and we were kind of presented with this idea that, well, nothing wrong was done, and maybe don't need to provide all this stuff to you, or I don't understand why I need to provide this stuff to you. I don't know if I'm getting the same impression today from what we're being given. It seems very comprehensive and like it's there's an effort to check the boxes that you've given of what kind of things do we need to see to be more comfortable.
Yeah, I'd say that's accurate.
The temperature check, what, how do we proceed?
My question is it, and because I'm not directly in the field of how things work, what would be if we could go situation as far as the supervisor goes, given that this licensure process is newer, given her years of experience, would there be a certain, qualification that someone could supervise that you all would feel comfortable with? Outside of, I completely agree that the conflict of interest of her working with you should definitely not be a case that shouldn't be.
Well, we can put it in order that, if you go down that road, we can certainly put it in order that the practice monitor needs to be independent of the practice, and that even with the approval of this current one, that any of the current, clients need to be transitioned to another appropriate provider.
Within a set amount of time, so that we're not delaying patient care,
Yeah.
but also that we're not dragging our feet.
I feel a slight bit better with a supervisor, and I know we talked about what we've met these requirements and other ways, you know, through PCP and all that. But she's not practicing pregnant. We haven't seen the stress of that
Sure.
being played out.
I've been there since 2020.
Well, but not their license.
Not licensed.
Well, yeah, I mean, yes, I haven't.
That's what I'm,
Provide me
yes,
some
I'm
kind of-
referring to that, like, we don't have that. We don't have that under our belt, so to speak, right?
It's July first.
Since July.
Prior to July first, yeah, been practicing, in 2 years, almost 3 years. Yeah.
Well, that's what I was, you're still practicing in other states?
Active license in emergency.
Are you practicing in those states?
I don't currently have any case loads, but I do have active license.
And are those through your organization?
I'm employed, in Missouri, I'm employed through Howard, and right now I just sit on the human rights committee and, do quality assurance. I don't have a case load there currently, and then, in Nevada, I am deployed through ABA group, and I've done some, telehealth parent meetings, foster care parents, providing some behavior management training kind of thing to foster parents. But I'm not doing, what we would consider to be typical ABA in either state, but I do have active licenses in most states.
Can we do that without a motion?
Certainly, we can continue discussion. The way I see it, there's kind of two things you have to wrestle with. One of them, before you even get to the point of how comfortable you are with certain terms of probation or kinds of things you want to put into place. I think the question you need to first answer clearly is what exactly the deficiency is that you're trying to remedy. In this case, what are we trying to make better by going through this process of probation? Because once you answer that first question, then it's really going to drive where you go with that second part, whether practice looks like we're giving you a license and saying, here's your second chance, giving you a license under conditions, or whether you're saying we just can't do it. And the question you have to answer particularly is whether in the determination of this board, you can practice with reasonable skill and safety to the public.
I think the most concerning thing for me was the fact that nobody in the organization thought to report it.
Yeah, that's.
So I guess that for me, the deficiency would be like a training within the organization about what's reportable.
So that's been done. Yeah, that's been definitely done. And they all do the child abuse reporting and all of that every year. Some of those things weren't required years ago. And so things might have fallen through the cracks, especially in COVID eras.
Right.
I know there's a lot here. Do we have documentation of that training? Is that something that the BCBA, that the national?
No, it's actually not required in Indiana. I have to do it every year for other states. Both my Missouri license and my Nevada license require it.
Mhm.
So this is something within your office though that you've implemented?
Yeah.
Yeah. And how often does that training take place?
Roughly. When IT remembers to click the button, or we remind IT to click the button. I want them to be secure required it, so if ACQ required it, it all would have been done within the last year, because we got our accreditation in July of last year.
Others, we've seen other episodes or any recognition from any.
Yeah, I agree with you. I was struggling that it was reported in house. I know, like, I do a lot of long-term care, right? And we do abuse education anytime there's even a question. of, Or, even if we don't think that they're guilty of anything, they're suspended pending investigation. And that we don't do that, we have the Board of Health that will tell us that we didn't do the right thing, we will be fine, like both. So, we definitely take that seriously when we're taking care of people who can't take care of themselves, children, also any vulnerable population. So, yeah, that's definitely concerning. Sure, rather than somebody report something and an investigation proved it wasn't true, that to have something unreported at all. Absolutely. That.
And that training, I think, for now, part of the practice, yeah.
Yeah. It's not actually, I don't think it's in the whole packet of 100 pages, but DCS did investigate it and did not find any. There was nothing.
That isn't.
Is it? Okay, I didn't remember. It's somewhere along the way that document got misplaced.
Yeah.
It's somewhere along the way that document got misplaced and we weren't sure if it ended up there.
Yeah.
At least there's a narrative about it. Yeah. Maybe. Okay.
So to answer your, the question about trying to monitor. We have supervision, we be supervising. And supervise a past action. Only supervise what's happening currently. Forward. To prevent future action, right?
Yeah, it'd be precautionary.
Yes.
Almost.
Yeah.
So do we as a board want the next case that comes to us? Same thing.
What do you mean when the next?
Like the next, well, similar, what's our precedent that we're setting today?
While you are required to maintain consistency in the decisions you make, this is quite, I would submit that it's a remarkably unique case. And I would submit to you that if you had someone else come in the door that had just had something like this happen, I don't think this is precedential to something like that. There's quite a bit that would be different about that scenario. So I don't think you should be concerned about potentially setting a bad precedent when you're addressing a very unique set of circumstances.
I think you're right. And as I started the conversation, it's the timing piece is very unique. We had licensure in 2020, or this had happened in 2026. This is all
We
based on.
totally.
Exactly. Yeah. Right. The turn.
Like, true.
Yeah. That's the part that I'm grappling with.
Yes.
It's confusing.
You know, I appreciate the work that, you know, done to following up with the things that we've asked you to do. I appreciate that a lot. My struggle was doing all of this. I don't think I've heard once something like, sorry for that. Or something along this. That's a struggle.
Sure. I think the discussion has largely been about,
You know, because there's ownership.
of course, and I think Ms. Stein would be more than happy to talk about that right now. The conversation really has been about, you know, the monitoring, the hoops and so on and so on, which is why it hasn't necessarily come up. We haven't really had a personal narrative, but I know she's spoken to this with me many times. I know she can do that now. It's been a life-changing event for her. It's not just, you know, a professional inconvenience. She harmed someone who she's dedicated her entire career to helping. That's not something that you can just overlook. Yeah.
That's a part of it.
For sure, but again, that's why I go back to, this was a medical event. And if the physician is saying that that's what prompted this, we really have to put a lot of weight into that. Because it's not like she woke up someday and she decided, I hate these kids, I'm gonna hit one. You know, and I know you're not saying that, but this is a medical event that unfortunately harmed someone else in the process. You take away that intervention, the medical intervention prescribed to her by a physician, following doctor's orders to treat a real condition. You take that away. She has 32 years of flawless work for these kids.
I would say the risk is not gone. I mean, mental health, hormones, medication, that could, I mean, you could be prescribed a new medication that we don't know what side effect is, and if this is a known response to something, I would say the risk is not zero. There is a risk that, you know, given the right perfect storm again, I know the risk may be small. I would say it's not zero though.
Right. And I would posit that that's true for everyone who's licensed by this board.
But not everybody that's licensed by this board has
Had
injured a child.
had that unfortunate rare event, absolutely.
Good questions.
I do not. I think I'm comfortable making a motion to deny a license today. Favor or any discussion?
I guess I'm not comfortable with that. I don't either. I don't see a pattern after this happening.
Okay.
And concerned with some things, but not to that extent.
That's fair. I mean, we can just agree.
Yeah.
So now, so you are saying 2-2, no, and
There's,
continue to discuss.
I think where you're gonna be at an uncomfortable problem is it drives the conversation more toward probation, but you have to answer that question of what exactly are we trying to improve, because you don't want to impose a probation and come back and have the same conversation in 6 months.
I think
You're gonna have to wrestle with, does she get a license or not? Can she practice a reasonable skill and safety or not? There's quite a bit of information here to consider now that perhaps you didn't have when we began this journey a few months ago. And it's not, I would say this, it's not typical from a documentation standpoint that everything that you've gotten from outside sources has pointed toward less risk rather than more risk.
I would argue that nobody's going out looking for letters of risk, though, you know, the only letters that Mrs. Stein is going to provide are going to be positive.
That's not true when you're talking about medical evaluations and
That is, yeah.
Multiple language was impartial.
all right.
I think to answer, what are we looking for with probation? I think, yes, this happened 6 years ago. But personally, for me, given, as we said, the severity of it, I would like to, once you are in your period, still see for a while. I don't feel comfortable fully taking off the hands and saying, okay, just go. So that's where I'm saying possibly probation. We can keep a closer monitor, make sure that you have the appropriate supervisor, make sure that that they're not employed by you and all of those things. Is where I'm at.
It opens up that pathway for people to communicate directly to the board. These quarterly reports that we mentioned, she has no way to intervene on, intercepting bad reports and getting you one from somebody else that's good, right? The monitor will be communicating directly with this board, providing any good and bad feedback that exists.
All right, board, I can try to lay out maybe based on what you've discussed, some terms of what probation could look like. That starting point to further the discussion. Hear that?
Sure.
So could consider an indefinite probation for no less than 1 year of active practice as documented through 4 sufficient quarterly reports from the practice monitor. Applicant must practice under the guidance, supervision of a practice monitor approved by the board. The board approves Megan Gildersleeve to serve as applicant's practice monitor, provided that any active casework with applicant's practice by this practice monitor is appropriately transferred to another provider. Any change in practice monitor must be approved by the board. The practice monitor must be independent of applicant's practice. Applicant shall cause the practice monitors to submit quarterly reports attesting to professionalism, quality of work, any information about incidents of unprofessionalism, or any broader concerns of safe practice. Applicant must document weekly mentorship meetings as a part of the monitoring. If applicant is not practicing, then applicant shall submit a quarterly written self-report. Should need to keep contact information updated with the board and follow all other laws and regulations regulating the profession. Immediately report any arrest or discipline to the board.
Is the monitor or mentor a volunteer, or do they get paid by you?
It's a volunteer typically.
And there's a comment.
Yeah,
So yeah,
Well,
every time we've done this in my firm, it's always been perfect. They're just trying to help out the profession, yeah.
You can do different, and it doesn't have to be like a weekly, you can do a different goal if you want, you guys talked about it in the goal.
Yeah, the
Feel free to
report,
change anything, right now, this is just me saying, here's the start point, so.
and the reports are done quarterly. You can require that she meet with the monitor at a more regular interval.
You know, we had asked for someone in person and local, and that's how Megan has come out. As I mentioned, I don't feel very comfortable with her. Actually, she's only been a BCBA for 3 to 4 years. Maybe considering, laughing at myself, someone virtual with more experience, if that's appropriate. I'm asking, or if there was someone other than Megan that could be offered as a mentor.
I do have knowledge. I do have knowledge.
And I guess there would be somebody that has already written any particular person in
Bobby Newman has offered it.
Newman.
Bobby Newman.
We have had before the boards that we have had arrangements before where someone has both a practice supervisor and a practice mentor. The practice supervisor more than likely would have to be someone employed by her, but the mentor could still weigh in. So I don't know if this would be any better, but you could consider, you know, this Miss Gildersleeve that's more local, being in like a supervisory role, and then maybe the out-of-state person being the independent practice mentor who's providing some more of that like outside perspective. I don't know if that makes it any better or not, but that would be a way of, if you're concerned about the experience level alone, that would check the boxes of having someone local and having even more experience there. But if you feel it necessary, I don't know if that's just making it more complicated, but.
Yeah, I don't know that if we were to have someone like Dr. Newman involved, I don't know that Megan would be needed.
Yes.
I just don't know what we
Dr.
would
Newman.
contribute.
Dr. Newman,
No, he's in New York, it looks like.
Yeah.
originally you were concerned about there being someone local.
I was, yeah, but if the only offering of someone local is Megan, I'm reconsidering whether a virtual person would be a better option. But yes, I did, I mean, in a perfect world, we'd have, I mean,
We want somebody licensed.
Yeah.
You know, like,
yeah. Yeah, my preference would be someone local, someone with multiple years of experience, someone licensed, someone. But if that's not available,
I'm asking somebody to do that, to give a lot of their time.
yeah. What is our typical relationship with that person? They're providing us with a quarterly report?
Correct.
Is that about it?
Well, and they need to be approved by you,
Right.
obviously. And they would be providing, yes, they would be providing these quarterly reports and anything else you might include. You're also going to be relying on them if something comes up in the interim. I think, Patrick, you might have some language that went more particularly to this, but I think you're also relying on them to immediately report to you if there's like some sort of like bigger issue.
Yeah, it's like,
There's something more urgent.
you know, a new criminal charge, a new investigation, I've seen for terminations, which is self-employed, any kind of patient abuse event. They're required to report that in addition, to the quarterly reports to the board within, I think, like 7 days. It's usually 7 to 10.
And that includes in-state and out-of-state issues?
Any incident they're aware of involving this time.
So because they don't have like boots on the ground, is there any sort of mechanism, sorry, this is like not important, but like some way that there's some sort of feedback given by the staff, like some anonymous feedback that the supervisor could gather?
Right, we talked
some
about,
sort of interval.
that's what we talked about with Ms. Gildersleeve, at least that she had direct access to all the staff who could convey things to her.
Right,
Yeah,
I think like it would put, puts everybody in an awkward position knowing that your licensure on the line, you know, like give that feedback, so.
Yeah.
How does she have direct access though?
Because she does occasionally provide or has.
Oh, but she has close, that's what I'm
Right.
saying.
Because she has in the past, right, up to now provided some elementary supervision to my staff. She does have interaction with my staff, and she would have an easy communication mechanism with them. The same could be established with Bobby. If that's, and he's done like continuing education talks for us remotely before, so my staff do know who he is. I think most people know who he is, but, and if it, for those who don't know him, he's also a clinical psychologist as well as a BCBA, so that adds a layer of comfort.
He works at Proud Moments, which is who you work for in other states.
Yeah, the other states are Empowered and the ABA group. Yeah, I don't have any working relationship with Bobby, I've just known him for
Yeah, as a student.
a very long time. Yeah, 32 years I've known him.
So the deficits were the self-report and then a concern for a future medical event, right? So, yeah. So I think that's where you're thinking, like, somebody that's out of state, they're not gonna see that medical event unfold.
So- To the point of that being the second, so what, might I ask, like, what counseling or care today?
I do mostly weekly meetings with a licensed social worker. Like occasionally we miss a week because somebody's on vacation or somebody's sick, but otherwise it's weekly. And then I think I mentioned back in April, like essentially the entire medical team that resulted in this medical event. And so I do have, you know, regular contact with new providers who are aware that this occurred in the past and that this reaction did take place. I even changed pharmacies because honestly, it was something that should have been picked up by a pharmacy.
So that's like, that's individual counseling.
Individual counseling, and
On a
then
weekly basis.
on a week, mostly weekly basis, and then the other medical steps to prevent a future medication issue.
So like going down that, if we do the probation, I personally am not concerned by quality of work. I don't know if anybody would have to look at that. And, you know, things otherwise, I'm happy to defer to the majority on that for sure. That's what we're going to do. I think it's like some of the papers that were read were like that you were off and maybe there was some professionalism concerned about one or something. There was like something that was different about you or something. Yeah,
Yeah.
so like more of that kind of thing.
I would say that I would want some clinical oversight in our documentation, the use of restrictive intervention, the use of punishment in practice, the use of anything of that nature. How does your organization or your employees report things? What crisis management training takes place in the organization? Like that's where I would, no, I don't care about skill acquisition or, a Vineland or something like that, but I would want to know as,
Are the policies in place?
the policies
training.
and then, some, you have 4 patients right now, but out of those 4, how many are using restrictive interventions on a regular basis? How many have punishment procedures in their treatment plans? That kind of stuff. That's what I was looking for.
Yeah.
Clinically.
The answer to both of those is not, by the way.
Hypothetically, if we were to go with, and Dr. Newman hasn't agreed to this yet. So if we were to make a motion today to do this under.
He did agree.
Oh, yeah.
Yeah, I don't have a letter for you, but I do have a agreement from him.
Is he the only person you had asked or?
Other than, I had asked Dr. Barthold. And the conflict there is that I do pay her for some supervision of my BCABA at times. On the plus side, she has weekly-ish interactions with my BCABA. And she is part of that mentorship group that is currently on hiatus, but with, that once a month, Monday night group. Bobby seems to me to be the more logical option, especially with his clinical psychology background in addition to the BCBA.
We didn't provide a letter like Ms. Gildersleeve because the board specifically was looking for someone
Yeah.
local,
Yeah.
but that agreement is in place, so.
But I have it on, I can pull it up in a text message. If you want it in writing. Okay.
Just my general question was if that would delay.
What we can do is, as far as the order, we can just say the practice monitor needs to be approved by you. And then once once we have the order and that's issued, you guys can provide that in writing for review by a board member.
Well, if it could, because we know that Bobby Newman has, agreed to serve this role. Bobby Newman can be approved by this board, and then if we need to change it, we follow your previously mentioned procedures for getting that approved by the board.
Bobby Newman.
Mm-hmm.
What was his certification?
PhD, BCPhD, and he's licensed in the state of New York. He's a clinical psychologist and behaviorist.
So you want the practice monitor to document, you named off, I think you named off a few things with the general practice procedures, and you want the practice monitor to submit something documenting them?
Oh, I was reading off the list that he had provided, the professionalism, the sacred practice, channel, from employees, the quality of work, is something that.
So there was something about like documenting like how restraints are used.
Yeah, in clinical practice, the use of punishment, physical management, yeah. It's culture of pain.
Do you want anything in particular, you're wanting something in particular provided by the practice monitor, or you were just bringing that up as general things?
Yeah, I want the practice monitor to work with for, if those are taking place within the organization that they're being discussed to be remediated and faded out. Not to say that it's never appropriate, because sometimes we do have to do those things, but, that there's some discussion around that.
The system is already in place in practice to address this.
Well, we don't use punishment. There might be an occasional timeout, for medical punishment, but it's rare. But that's it, as far as any punishment procedures. And then, the extent of physical management at this point in our practice is blocking. So no physical contact with the learner, for behavior-related
So I
procedures.
think the answer is yes, you occasionally use timeout and you occasionally do blocking, which is hand, physical
It's not
contact.
no physical contact, just like this.
It falls in the category of physical management.
Okay.
It's trained to get physical management.
Sure.
So I'm not saying that you're doing it inappropriately. I
No,
just
of course.
answer what feels.
Okay, no, to me, that, yeah, when I think of physical management, I think of holds and things like that.
Yeah, so we can include all of those things, of course, in the reports.
Get your staff feel free to work on it anonymously and comfortable with that, you feel a little better with these things.
So maybe establishing a requirement that they all be given direct access to whoever the monitor is.
In some capacity.
Yeah.
With guidelines of what, you know, you don't want somebody to mad at you that day, right? Nothing like that, but like with some pretty clear guidance as to what that.
Sure.
And practice this, so I don't know what those guidelines should be. But, you know, very clearly, these are the things you must
Yeah.
Yeah.
report. You must, there is no option. If you fail to do that, you don't work your, you know what I mean? Like, that's how it should.
Sure.
in vulnerable populations.
Yeah.
So. I
So if we were to
I might be able to get there with this.
Yeah.
And staff being able and feeling free to.
Sure. Would you want them, sorry, to report to the monitor or directly to the board?
That's what I was gonna ask as well. I think they could be given options, whichever they feel more comfortable with. I mean,
Sure.
They can report anonymously to the AG's office, and that would come to us eventually, and then you would never even know who it was. They could go to the mentor, they could report, if it is a concern of abuse and neglect, report that to CPS. So I think educating your staff on all the things
Mhm.
that are options.
I was going to suggest, at least for purposes of the order, that the practice monitor provide a way for staff and practice to direct or report any concerns and include such procedure and feedback within the reports.
Yeah, so they can figure out what that meant.
We can set up a mechanism where staff can communicate directly with the body. Also, as part of the ACQ accreditation, they have to be able to. report to the ACQ.
Would you all be able to provide that to us so we can see what your methods are?
Yeah, that's something that can be included within the practice monitors
Okay.
report, and then also, like, they could say, like, because this hammer also swings both ways, staff could go to the practice monitor and say, hey, these things are working really well in practice. Here's like some positive feedback right now. And that could be included in the report. Obviously, if there was anything negative, we don't want them to wait the quarterly to say, hey, there was a problem, but they'd be able to say, hey, we didn't get anything in these 3 months. Hey, staff member brought up, this clinical issue, that clinical issue, here's what we did with it. But I think I have some language in here.
So then what does it look like today? Do we make that decision? Do we write this up and get an agreement and then make a decision?
No, we're talking about it now, just as I read off some provisions to you at the beginning. Once we go through these and you feel comfortable enough with them, then we can have a motion and a vote on it. I think a question based on some of the comments you've given me is, so with these supervision meetings, do you want the supervision meetings to be weekly? Do you want them to be bi-weekly? Do you want them to be monthly? What interval do you want them to be at? Given that there was the comment that this was a lot of work, the volunteers being expected to do. You want it bi-weekly, monthly?
Long time.
Yeah, the minimum duration.
Just supervision like that usually.
Yeah, I mean, for my clinical directors, a new clinical director, I'm probably meeting weekly, moving it to bi-weekly. But I'm more experienced, I'm doing monthly. That didn't answer your question.
I don't know if we, unless you feel it's necessary, I don't know if we need to go into like specifying anything like that, because we're putting details in here that the reports are going to have to cover. So we have to meet for a sufficient amount of time to get information wise. I think that's probably enough. Otherwise, we can say 1 hour supervision meetings at least, but there's topics they're gonna have to cover, so. Do you want me to go back through?
Yeah, and how long do we do this for?
He said in depth.
It's indefinite for no less than,
No less than a year.
and it has to be phrased that way because even if you have a minimum time period, since she will be on probation, she's on probation until she petitions to you to remove that probation. At which time there would be an administrative hearing with a court reporter. They would come in with all of their information and exhibits. And you would make a decision at that time whether to either withdraw, remove, or modify the probation. Which is why this all started with always asking that question, what are we hoping to remedy here? So that we're moving toward a good place. I think it initially had been thrown out, well, I think you guys said 6 months, and then I think you said you would be comfortable with around here. So we can talk about that time period too.
You know, and like you said, it's open-ended, if something came up during all this time, or whatever. Could address it. Got a report that was on, we could address anything.
Okay, so what you're saying, you need to, we read what we've got and then we can make a motion around that?
So the motion would be to grant a license on probation, indefinite probation for no less than 1 year of active practice as documented through 4 sufficient quarterly reports from the practice monitor. Applicant must practice under the guidance and supervision of the practice monitor, independent of applicant's practice approved by the board. The board approves Dr. Bobby Newman, PhD, BCBA-D, as a practice monitor. Any change in the practice monitor must be approved by the board. The practice monitor must be independent of applicant's practice. The practice monitor shall submit quarterly written reports to the board attesting professionalism, quality of work, any information about incidents of unprofessionalism, or any broader concerns of city practice. The report must document at least bi-weekly. Didn't reach a resolution on it, so at least bi-weekly mentorship meetings as a part of the monitoring. You find monthly?
You said, well, you
I said bi-weekly.
I don't think that we made a decision.
said,
Yeah.
well, I think it's monthly, but you were saying that a certain amount of time would have to happen, so then it would be up to them to figure out. Because they'll have to,
We'll have to submit the quarterly
right,
reports and we get every 3 months. But I'm asking what you want to be documented about those meetings, so you might want to at least see an interval. I just didn't know if you need to go into saying it needs to be at least 30 minutes or an hour or 2 hours, you know, if they have topics to cover, then,
The time's gonna be the issue.
Yeah.
right.
You want it to be bi-weekly or monthly?
I'm open to what the board says as far as that goes and what you guys think.
Monthly,
whatever. They want to be wrong. I think, yeah.
document that use. The practice monitor shall document that the clinical procedures of applicants' practice are discussed within supervision meetings. The practice monitor shall provide a way for staff of the practice to directly report any concerns and include such procedure and feedback within the reports. Applicant, I threw this in here, so you can tell me yes or no on this. Applicant shall continue treatment with her counseling provider. She shall cause her counselor to submit written quarterly reports to the board to document progress and compliance with the treatment.
I like that.
Keep all contact information updated with the board, and applicant shall follow all laws and regulations regulating the profession and immediately report any arrest or discipline to the board. Failure to comply with any provisions of this order may allow you to issue an order to show cause. Anything else we need in there?
The meeting is, how the employees make that contact or what the education in place looks like.
It says that they show. Read that in the report, right?
Yes. And they've kind of said that they already have something in place, so I think. Yeah, sounds like that'll be pretty straightforward too.
Just that they need to present it to us.
Yeah,
I would like to see what they have.
because I mean, you can,
Anybody can say it.
Yes.
yeah, well,
Well, so, what I have here is that they'll document, or they'll provide a way for staff to practice to directly report any concerns and include such procedure and feedback within the reports.
right. So I believe that what they had noted is they've done abuse and neglect training in the past, not something specific to reporting.
Yeah.
This, so I think that would need to be created and provided to us.
And allow anonymous reporting.
Yeah. That's-
So if I can clarify, because I want to make sure procedurally we're good here. One option I think for this, instead of, putting this on the agenda for the next month to approve that mechanism. Have a requirement that the practice monitor explain what that mechanism is in that first quarterly report. And then if it's deficient, you have that order to show cause option that was mentioned.
Well, I think they will have to say, here's what we're doing in each of the reports. I think. I don't know if we even necessarily need an order to show cause. It's just if you get the first quarterly report and you guys say, hey, we have questions about it, or we really like to see this or this. We can probably just send an email back that says, hey, the next one. It needs to have maybe some more of this detail, right?
Yeah, we can do that next.
Yeah, I think that would cover that. We could just have that dialogue. Otherwise they're at least doing the reports, and obviously the board satisfied with the detail of it, it's gonna be in the best interest to say here's more. Does that make sense, or do you still think you want to spell out a little more specific?
It makes sense for us.
Okay.
I just want to make sure it rises to the level of what the board is wanting to see in place, yeah.
Essentially on this education report.
To the practice monitor.
Or that they can.
Or also to the attorney general.
As well.
Yeah,
Yeah.
absolutely. We'll give them both.
The motion now?
Yeah.
Make a motion that we grant a probationary license under the terms that. Have you give a time frame on that, or is it just the indefinite, but at least a year?
Indefinite for no less than.
Second.
And this is, we've crafted it to, it is active practice, so. For some reason, not anticipating it won't be an active practice, but if for some reason she said, I'm gonna go on vacation to TV and do something for 6 months, the clock kind of pauses.
Yeah,
So,
that's really nice, yeah.
That is.
We have a first and a second, all in favor? I oppose.
And thank you guys very much.
Thank you.
Patrick, so, just so you guys know, like, next steps, so that license won't be issued until,
The final.
when the issued order.
Mhm.
You're welcome to, submit proposed language for the order based on the date. We've obviously went through a lot of terms. Do you have my email?
Honestly, I don't think I can. Just surprised.
It's Adam.Harvey,
Harvey.
correct,
Mhm.
at atg.in.gov.
Perfect. Okay, thank you very much.
Do you have Brad's, email?
do. Yeah.
Okay, sure. Yeah, so just CC Brad as well. I'm just gonna remember to.
I will. Thank you all.
Thank you.
Would you like to give your report?
Yes.
Come on up.
Sorry to go in and out.
No, don't be sorry.
Couple books today,
That's
but
okay.
I'm happy to be
You're
here.
a busy guy.
So for your report, average age of consumer complaint is at 3.5 months with 9 files currently open and 7 files have been closed. Again, one of them has been referred to another state agency. The other 6 were closed without any action. I can tell you too that I know last time I heard before you had the conversation that July, the license was in effect, and then after that date, of course, anybody would be unlicensed practice. We did review our cases, myself and Jack, which is my investigator that works with the sport. And it does not appear that any of those involve unlicensed practice. So I am able to say that just because it isn't specific enough to reveal anything, but also I know that was a concern of this board is that individuals would continue to practice. Not to say that there isn't people out there in the state, but what you can expect if we get a case like that is that it would be turned in about a month or two. We work this pretty quickly, and you'll have it within a board meeting so that it can be addressed quickly and swiftly, so that the person stops practicing and then no one is in advantage of it. Available for any questions that help. Well, thank you all. I appreciate it.
Thank you.
Thanks for being here. Okay, now we just have a few application reviews. Natalie Absher. We're moving into some application reviews.
I'm one of those, that's.
You're one of the application reviews? Okay. So you're just here to listen? Okay.
I couldn't listen to the last meeting because there was like an issue with the recording and things
Okay.
like that, so. And then I just kind of, this has been obviously really impactful for me and I've remained unemployed during this time, so, if there were any questions, then I don't have to wait until an entire another month.
Okay. And what's your name?
Corinne Seabock.
Let's jump to that one.
Yeah, let's do that.
Dr. Anderson needs to leave out one. So.
Oh, that's fair.
All right, we review all these ahead of time and then
No, you're fine.
the day comes and there's so many.
There's always like something.
And they're ongoing and from month to month and more information.
And you had written us a letter too, right?
Yeah. Yeah. Oh, failure.
Yeah.
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 A lot has happened since 6 years ago. So. In a good way.
You want to just tell us about?
Yeah, so, so I guess 6 years ago, there was an incident, where a staff had made an accusation, with my place of employment that I had an inappropriate relationship with, a parent of one of my clients. That did not occur. And there was a whole lot that went into that, and the employee and the company investigated, and it was reported to the BACB. And so I went through remediation with them. I think the biggest thing I took away from that is I did not self-report, and not because I did not feel like it was an issue. My understanding with things with the BACB is you're supposed to try to handle things amongst yourself or within your organization. And so I feel as though the company that I worked for, we did that. There was an internal investigation and things like that. But so since now going through that process, I've learned that like the BACB also needs to be involved in that and make sure that all of that is handled sufficiently. And so that was kind of the biggest feedback that I got. And it was also during COVID time, so it was a really slow moving process. But I got, feedback from the board was probation for a year with a mentor. I had to find someone that I had never had any contact or professional and I've worked for 6 different companies in this state, and so it couldn't be somebody that's previously employed at any time, any overlap, you know, within other sites and things like that. But so once I got that, then I met with the person monthly, for at least 2 hours. To just talk about if there had been any conflicts that had arisen, or anything like that. And really, for the 2 of us, it kind of became like, a therapy session of realizing how often you get put in a position when treating families that, you know that they're struggling in this area kind of thing. And so then they get feedback and they're wanting like counseling when they come to the therapy meeting or the parent meetings and things like that, and really having to have those barriers in place. And so she and I would talk about that a lot, of how my experience specifically really just showed, you know, where those boundaries are and where they should be, and really how often you're put in a position where you could jump over that line, and really with the intention to help families. And so I think that one thing that's changed a lot for me in the last 6 years was, you know, when I saw a family that was really struggling, the parents didn't get along, and I was trying to help treat children, I felt that I was trying to help the parents better co-parent, which was helping the children. And that wasn't my place. That was the big mistake that I made here. And so just building rapport with them, was beyond the scope of what, like, directly treating the patient, referring it back to the patient's, you know, therapy sessions and things like that when the parents would try to take it off track. But so it really came from a place of just wanting to help this family and feeling like I had to build rapport and able to make the biggest impact for the patient. But so since that time, I've moved up in several roles and have been a clinical director for the last 6 years. This experience I've taken so much into, I'm a cautionary tale for my supervisees. I have really strict boundaries, and I think more so than is required by the board, and that's not just because of not knowing where that line is, but I just learned from this that, like, my personal and professional, I'm not gonna blur those lines, and that, you know, whether or not I had a license impacts my family and things like that. And so I'm not friends on Facebook with people. I don't go out for people's last days, things like that, because everybody's there and they're drinking, and I have really strict boundaries now, and that's what I've learned from this. Self-reporting is a big thing that with my supervisees that we go over now. Something that I remember being in a newsletter, but now is very much a part of my training process with my supervisees. And so, that's just kind of where I'm at now with this entire situation. It was a really big impact, but I think in a good way.
It's great when you can use your own experience.
Yeah, happened to me, and
everybody thinks, I think that, you know, like, oh, who's gonna report it to the board kind of thing. And it's like, well, just the lawyer. Yeah, it does count.
Yeah, there was something in there that I read about maintaining confidentiality. Can you elaborate a little bit more on what was that?
The accusation was that I was talking about the patients to staff, or like issues that were going on with the family. So things that, like, beyond the scope that, like, the RBTs don't need to know the conflict that were going on in the home kind of thing, but that I was specifically divulging to an RBT who ended up being the one in the end that made all of this accusation. What she was saying is that I was going home and telling her everything that's going on behind closed doors with, you know, confidential conversations with patients.
Okay.
Right, and that was the one that you sat in the termination meeting and then she was that kind of.
After termination,
Yeah, and so that was kind of a situation where, you know, I had an RBT, I was closing one day and found that she was unhoused and living in the parking lot and had been for quite some time. And so I immediately, on my way home, called my supervisor and we talked about it. And because I had, you know, a spare room, and she stayed with me for about a month, but she was removed from the BACB. She was on the other team. She was not allowed to work on any of my patients. I feel like I did the best of my ability, to, due diligence in that regard. But so then when all of this was, so she went many, like more months and up to a year. I want to say that she was not on my team, did not work any of my patients. Her BCBA was out on the day of which she was terminated. And the company policy was that which there had to be another member of the management team, to witness. And so I was asked to witness, in that supervisor's place. I did not leave the meeting. All of the documentation just said that I was there, and I literally signed it as a witness. But then she said that all of it was retaliation for the fact that I had done all of this stuff and divulged all this information that prior year that she lived with me that month.
She's under the review.
Yeah.
Yeah.
And this was all in 2021.
Well, 2020 was the accusation.
Yeah.
February of 21 is when it was brought to light and investigated by my employer and the ACB.
Yeah, I don't have any.
Yeah, sure. Have issues either.
Motion to grant the license free and clear.
Second.
All in favor? Aye. Wonderful.
So I do want to talk about your letter that you sent,
Yeah.
Okay,
because we're not reviewing the applications. That's not the process of.
oh, they email letters?
Yeah.
Okay,
Yeah, so when they come before the board, so the PLA, they look at the applications, and Cindy, please tell me. I'm missing, but, administratively, then they, grant licenses, and then some they'll flag, like the ones with positive responses, and they go into two categories of, review, and then the ones we want to appear before the board. So you're in the review, like you hit that. So usually we could just talk about it within here and then we would approve it or ask the captain to come in. So, in terms of everybody else out there in licensure land, we don't look at those. That's all that happens.
And the 300 that are pending because their background checks have often either the background checks haven't come back or we've identified, like Jill said, something positive about their applications. They're not just sitting, not being looked at. Like, in fact, I think Cindy, noted someone that applied just a couple of days ago has already reviewed that application and now the background check. And we are very aware, and the PLAs too, that I Good to Go has many issues with the fingerprinting. They get lost, they go to the wrong agency. That has been a hiccup for many people. But yeah, we are certainly not delaying license on purpose.
yeah, and so my email, that's why I asked about like the temporary licensure, because for example, with it, so myself and two other practitioners, one BCBA, one BCABA, in my site, in my clinic, which was all three of us, were pending. And no one quite knew the timeline. And to be honest, when I called like the number to try to get information, I got different info every single time I called on what to expect and what was next. And that's why I asked in my email about like the temporary licensure.
Yeah, so our, I may correct my language, but our law for behavior analyst licensure did not include temporary license. So that's not something we nor PLA can do without legislative action.
Correct.
So we attempted that last year, and that bill did not get passed.
Well, you didn't
Well,
attempt at the professional
Yeah.
organizations, right?
yes, yes. You're right. We did not attempt anything. Yes, it was attached to a bill regarding music therapy therapist licensure, and that did not get passed. So, we are unable to give temporary license until that is added to our rule.
Gotcha. So I think for me, like even, like I would have had, with this entire situation, the board gave me a letter that was like, this is closed and this letter is what you can use, moving forward if something gets brought up. And so then it put me in a position of like, well, I wasn't given the background check situation. So like, what do I say to tell the employer when they're trying to make the decision of whether or not to keep me on or, like do some type of on a leave of absence or something like that. And like I said, then I was calling and getting like different answers. And so that's why I sent that email, because it was just really hard to like understand And then for other people and kids going without treatment.
Yeah, and I mean, and that's why we finished the rules actually last May, I believe. And so people, these BAs in the state of behavior analyst had over a year to apply for licensure. So I apologize for being crass, but someone who waited to apply in June, you know, we can't do anything about or rush them or have much sympathy because there was a year.
There were a lot in May and June, so just backwards.
But it's like, and again, like to my situation, so when I revisited in January to try to, give my statement, it was moving from like the old system to the new Indiana One licensing thing online. And I even went through tech support 2 different times with the PLA to say that like, hey, like my application is gone. I'm even willing to do another one, but it said it was pending. So I went through this with tech support and all those things. And then literally in June, the button for additional documentation, which is how I would have gotten my statement to you, the drop down didn't work. It literally was blank. And I went through tech support with the PLA again. So it's just, and I know it's a new thing. I know that there's just been a lot going on here, but for me in particular, it was just understanding the like timeline and the process. So that was just like my suggestion. I didn't know about that. Like personally, I would like to like help, be able to, you know, if there were something to be able to get that temporary licensure, not attached to music or something.
Yeah,
Or something in the future.
however, legislators.
But yeah, I think that it would just have been, it could have been beneficial. Anyway, that's all.
Appreciate it.
Yeah, I really appreciate you writing that. And I want to be clear, if it wasn't, you have the vision of us just like, we can get a break and partner, we're
Yeah.
pretty like.
Well, and at one time I was told on the phone that it was, and the words were, you guys have families and full-time jobs, and you do this in your spare time. So it was like, okay, so like I just gotta wait,
No.
kind of thing.
No,
So I
we
would,
need
that's what I
one
was
of the
told on the phone.
For the ones they filter to
Right.
us. though.
Yeah. Okay. Well, thank you so much for your time.
Thank you.
Okay, hopefully that license will be coming here.
Yeah, thank you so much.
Okay, now to Natalie. Sure.
There's a lot.
Yeah. But you got inpatient treatment for it.
Few other Peters or something.
But she asked, do we just want her to appear then? What was the charge? It was
I think.
in 2025. Is it still, is she like on probation and stuff? Yeah, and we've seen people for about the same. I think anyone who's had some sort of criminal activity within a year.
Yeah.
I
I agree with her, especially something like that. But she's the one that had the, like, went inpatient treatment, wasn't she? Or is she, might be.
I don't remember that. I mean,
Again,
there's a lot of them. False identity.
Where does he know that?
Under the public record. That's description.
my case record.
No, it's not me.
It just says it just says public record. Is this like from a different? Is this from the actual background check? It looks different.
That's something that they can get, which I have no idea where it comes from. Because it's something that you can purchase for yourself.
Because not all of that is on her in my case.
But
And then she. It's stuff that's probably hidden, like. I'm sure.
unless it occurred in another
Oh.
state, it would be under my case report.
No, I think you can get like a percentage false evidence just by telling them
Well, that false
that. Not saying.
identity was the same time she got that possession of alcohol, minor in possession of alcohol, but she had fake ID.
This is January, she was in court. She pled guilty to operating a vehicle while intoxicated and endangering.
There's a lot of driving.
Yeah.
So you-
Ah, geez. Oh.
This is all happening in Wall Street, at least in the area.
This public records thing is really confusing me. That's not all her, is it? There's no name.
But in California.
Yeah, like stuff from Ohio, from California, from Mexico, Vermont, like that's sure, he's not work traveling the America. Getting arrested everywhere.
Where for everything.
Yeah, I mean, if you're speeding,
Oh, well, it's like,
if you're speeding in one state,
it's like some lawsuit, like civil suits. Conciliation, what's that? Those. You know, on my case, when you search someone who has like a popular name, it shows like all the,
Yeah.
well, sure, but they gave this.
so I think, yeah, she shared a lot. Nonetheless, I say we just bring her in.
Yeah, I'm good with her.
That's fair.
It was recent enough that.
She could,
Well, she may be under active probation.
right. And then Jamie Cook.
Jamie was another. Oh, we'll tell you about it.
Oh, it was two of them, yeah.
And then you had, I think that was the one that was said that they were minor or something, like possession of marijuana and alcohol or something.
That,
Is the my case screenshot something you guys pulled, Cindy?
yeah. That's right.
Is the my case screenshot, you guys pulled that?
Yeah.
Okay.
I usually try to pull other things, if it's something that happened, because sometimes people aren't real definite on what their, positive response to drugs, positives, or the large case report.
I think his was older than that latest and greatest.
Yeah, but it was a lot of stuff. I'm trying to see what he actually got charged.
WI. Yeah.
This is what happened.
And false and non-conforming that. He pled guilty to reckless driving.
And that's the only one that stuck.
Yes, I know, alcohol. False reporting, is a false reporting to the commissioner of crime.
But then when he was actually charged with was the reckless. Dismissed.
What's his precedent for reciprocity? In
Sure.
here, under Jamie Cook's, like it's not a related document, maybe. It is, I'm not searching that. Yeah, it does seem unrelated. Talks about dentist, dentist, right? I think it's wrong, like,
When we could have him in, but I don't think we would deny it.
I don't think so either. I mean, it was 6
yeah,
years ago.
I've been available for BCA since March.
Oh, wow.
So, giving the license.
Yeah.
JAINE, right?
JAIE.
Where do you want to do? We're gonna give Jamie a license.
Motion to, grant license.
I'm not gonna say let's do it. Sorry. A motion to grant Jamie a license for clearing.
Just a second.
All in favor?
We're tired.
Okay. Any additional discussion? Okay. Please. Meeting adjourned.
Well,
Oh,
there was those two applications that weren't here. Are we-
Oh,
yeah.
Okay.
So Jill worked for us when I was the CEO there.
Who?
Jill Miller.
Uh-huh.
Who's that?
Oh, Joe.
We're still recording.
Yeah, no, I'm just saying, so I was,
Gilbert.
yeah,
Uh,
that's what I'm saying.
Okay.
So I didn't know how that,
We